Repeat peroral endoscopic myotomy, a salvage option for persistent recurrent symptoms. Introduction. Achalasia is a rare primary motility disorder of the esophagus, with an estimated incidence in the general population of 1 per 100,000. Because its pathogenesis is not fully understood, loss of esophageal function is irreparable at present. As a result, current treatments focus on relaxation or mechanical disruption of the lower esophageal sphincter, LES, aiming for symptom relief and improvement in esophageal emptying, prevention of megaesophagus in the long term, and restoration of quality of life. Peroral endoscopic myotomy, POEM, has emerged as a non-incisional, minimally invasive endoscopic procedure that is fast becoming the most effective and perhaps primary and permanent remedy for achalasia. This approach incorporates concepts of natural orifice transluminal endoscopic surgery, NOTES, using a submucosal tunnel as the operative space. Published accounts of the initial experience in humans are more than encouraging, despite the relatively short-term follow-up data that are available. Short-term clinical efficacy has been achieved in more than 90% of patients subjected to POEM. Regardless of this notable success, symptoms may occasionally persist or recur after POEM, especially in patients followed more extensively. Given the low incidence at which this occurs, systematic analysis of diagnostic and treatment data after initial POEM failure has not been reported in the literature to date. Herein, we report on our experience of offering a repeat peroral endoscopic myotomy, RePOEM, as salvage therapy for patients with persistent recurrent symptoms after their initial POEM procedures, and aim to evaluate the feasibility, safety, and efficacy of RePOEM. Background and study aims. Although peroral endoscopic myotomy, POEM, is credited with high success rates in the treatment of achalasia, persistent recurrent symptoms may occasionally develop afterwards. The author's purpose was to evaluate the feasibility, safety, and efficacy of repeat peroral endoscopic myotomy, RePOEM, as salvage therapy after initial POEM failure. Patients and methods. 15 patients with persistent recurrence of symptoms after previous POEM, Eckhard symptom score greater than or equal to 4, were retrospectively selected from a prospectively maintained database housing a total of 1,454 consecutive patients with achalasia. The primary endpoint was symptom relief during follow-up, defined by an Eckhard score of less than or equal to 3. Secondary outcome measures were procedure-related adverse events, change in manometric lower esophageal sphincter (LES) pressure, and reflux symptoms before and after RePOEM. Results. All patients underwent successful RePOEM, a mean of 13.5 months, range 4 to 37 months, after execution of their primary POEM procedures. Mean operative time was 41.5 minutes, range 28 to 62 minutes. One instance of submucosal tunnel infection was successfully managed with conservative treatment. During a mean follow-up period of 11.3 months, range 3 to 18 months, therapeutic success was achieved in all patients. The mean symptom score pre-treatment was 5.6, range 4 to 8. Compared with a post-treatment mean of 1.2, range 0 to 3, p less than 0.001. Mean LES pressure also declined from 25.0 mmHg to 9.5 mmHg after RePOEM, p less than 0.001. The overall clinical reflux complication rate of RePOEM was 33.3%. Conclusions. RePOEM appears safe and effective as a salvage option after initial POEM failure, conferring short-term symptom relief and being free of serious complications in all patients.